We in the 3rd District are the most gerrymandered district in the entire nation. PBS actually came down and spent several hours with me, Jeff Greenfield did, and we were the poster child for gerrymandering. And the problem with gerrymandering is that it's done by local politicians to keep somebody in office. Hi, I'm Dr. Mark Plaster. I'm running for the congressional seat in the 3rd District of Maryland. I'm not a career politician, unlike my opponent, John Sarbanes. I've spent 30 years as an emergency physician. I actually trained in emergency medicine at shock trauma in the early 80s. After that, I had the opportunity to go to law school in my spare time and eventually became the medical legal editor of a legal magazine out of Washington, published by the Bureau of National Affairs. So over the last 30 years, I've practiced emergency medicine, but I've also been a policy writer and speaker on health law issues. My life changed, though, in 2001 when I joined the U.S. Navy Reserve Medical Corps. My son was a senior at the U.S. Naval Academy at the time, when the towers fell and war broke out between the United States and Iraq, my son and I became one of the few fathers and sons in American history to fight in the same war at the same time. I came home a changed man because I really fell in love with Marines, sailors, soldiers, and I realized just how much they had given to our country. And I came home and I was just heartbroken to find veterans waiting hundreds of days to get into the VA medical system. Not because of bad people all the time, but mostly because the system itself was so bureaucratic. People who worked in the system could tell you who the bad apples were, and you could not get rid of them. And most recently, my opponent voted against the VA Accountability Act. This bill would have allowed for employees of the VA system who had committed fraud and other abuses to be fired after 77 days of due process. And John thinks that that's not long enough. Most of us in the private sector who have committed the acts of fraud and such that were committed at the VA would probably have been escorted to the car the day that they occurred. And yet he says that they don't have enough due process with 77 paid days. Prior to that, the bill he voted against, they had 365 days of paid leave while they were being processed out. So I think that he didn't vote against this because he hates veterans. He voted against this because he's a pure partisan. He votes 99.8% of the time with party leadership, and if they told him to vote against it, that's what he's going to do. And that's what he did consistently, because he's a career politician. I have the benefit of not being a career politician. I'm going to go to Washington, and I'm going to represent you. In one VA hospital, 30% of the calls to the suicide hotline were being rolled over to voicemail because employees were leaving. I've been in the field with these men and women who have served under tremendous strain. And when they've come home, oftentimes seeing their friends die in the field, PTSD is a real thing for them, and we need to support them. The horrors that they saw sometimes are very, very difficult to shake. And our VA needs to reach out to them, needs to be responsible to them. In fact, I have told my constituents on my website that when I get into office, if you're not being served by the VA, I will give you a special VA number, a hotline number to my office where you can call and we will take care of the problem. I pledge to you that we will take care of the problem. Obviously, in the Iraq War and subsequent conflicts in Afghanistan and other places, our soldiers and sailors and Marines have dealt with traumatic brain injury because of IEDs and explosions and such. And I think that one of the things we need to be aware of is the stresses that they have encountered. Now there are situations and there are hospitals in the United States that deal with that very, very effectively. But we need to open the doors to our soldiers, sailors, and Marines to receive timely care for TBI.